This is our presentation, Idea, Disability, Deafness, and Campomelic Dysplasia by myself, Giovanni Honore, and Sidel Butler. Definition of deafness, according to IDEA, is a hearing loss in which hearing is insufficient for comprehension of auditory information with or without the use of hearing aid. There are four levels of deafness. The first level is mild, which you can hear most sounds but have difficulty with soft or high-pitched sounds. The second level is moderate, which you could hear some sounds but may have difficulty understanding speech without hearing aids. The third level is you could hear some sounds but have difficulty understanding speech even with hearing aids. And the last level is profound, has little to no hearing. The prevalence of deafness is approximately 36 million people worldwide are deaf or hard of hearing. Etiology of deafness, which is the study of the causes of hearing loss. The two main groups that categorizes the causes are genetic, hereditary factors. Examples are Usher syndrome or Pendrick syndrome, environmental, such as prenatal factors. Examples are infection, medications, perinatal factors, such are complications during birth, and postnatal factors are accidents and noise exposures. The characteristics of learners with deafness are communication may rely on sign language, speech to text, or other assistive technologies. Cognitive may have difficulty with language development, but cognitive abilities are generally within the normal range. Social slash behavior may experience social isolation or difficulty with peer interactions.
Campomelic dysplasia. Campomelic dysplasia is a rare form of the skeletal muscle having extra limbs or angular shaped long bones in the limbs in certain parts of the limbs. It comes from the Greek word origin campomelic, which is actually means bent limb. Yeah, Campomelic dysplasia, you'll see people with this or adolescents with this, they'll have different features with their facial expression or facial features, whether it be their genitalias may be misshaped or abnormal size. There's different characteristics that deal with a lot with the physical appearance of the body and with the sometimes, I guess, the cognitive level of the body as well. You can go to the next slide. Yeah. So some prevalences of Campomelic dysplasia is it's around 1 in every 40,000 people or to 200,000 people to have this disease or this disorder. It's a rare form of short limb dwarfism. Like I said, it has a lot to deal with the DNA pattern of the child at when it's born. It's also very found to be it can be found in during pregnancy or with an ultrasound or at birth. Seeing these certain chromosomes that are extra with the 46XY, they'll have different, like I said, features of their face with the jaw being maybe drooped a little bit, eyes maybe be a little widened, a flat face, maybe a short stature neck. They're not typically bow-legged, but they can have, angular features around the legs and things like that. Next slide. Yeah, so some characteristics, like I said, include prominent eyes, the bones curved around the spine and neck. There's also noted to have 11 ribs rather than 12. And then, like I said, with the mouth, it's called the Pierre-Robin sequence. So it's the mouth is kind of the roof of the mouth kind of just drops a little bit, causing them to, not be able to articulate or have a great cognitive sense of verbal language and anything like that. So sign language is a very as a high as their main way or could be their main way of communicating at a young age. So some tips, some teaching tips, modifications for success in APE using this is with adapted equipment, is to use equipment that's accessible and appropriate with students with physical limitations, or assistive technology, providing and modifying, with visual cues that meet the needs of these students. We have a lot of devices now that we can actually use rather than trying to force words down the student's brain or down the child's mind. We can just provide them pictures and visuals for them to communicate with us. Being inclusive, using ways to promote and get atmospheres around your school to have students participate with these disorders or these disabilities, and encourage students to express what they want, what they need to do to be in order for them to be successful in the classroom, not just APE, but in all of their classrooms from a young age to adulthood. And these were some of the resources that we've had doing the assignment. And to conclude, it's basically what we've learned is understanding disabilities, foster to the inclusion, try to find ways to get them involved, whether it be visuals such as task cards or maybe if not task cards, just visuals of checking in, tapping out, using assistive, high tech, low tech technology, whether it be a tether or it be some sort of a bell. Like I said, like these students are able to participate in physical education activity. It's just us being open-minded to figure out how they can do it. And yeah, that's pretty much it. Thank you.